All right, so we'll begin. So my name is John Wysocki. I'll be talking today about diet, nutrition, nutritional deficiencies, and IBD. And as you begin, as we get further into this talk, you'll see how these are probably concepts that are not native just to IBD, but these apply across the board to many other autoimmune diseases and probably a lot of syndromes that have no formal testing and naming convention otherwise, but you'll see concepts are applicable widely. And I think all people could benefit from many of these same concepts we'll talk about today. So I have no disclosures financially. This is a very interesting quote I like to reference. Is perhaps among the greatest physiological wonders of evolution that the most highly evolved immune system ever engendered and remain unperturbed while surrounding the highest concentration of bacteria on the planet, separated only by a tenuous sheet of tissue 1 cell thick, by J. Pravda. I think this underlies really what's going on with our GI tract as part of this brain-gut axis you always hear about. We're certainly talking about the elements that feed the gut and just how important they can be in the grand scheme of things. And it's another quote you always see routinely. I was on a presentation yesterday and saw the same quote, but for a completely different reason, but from the famous Hippocrates, for which we take a Hippocratic oath in medicine: let food be thy medicine and medicine be thy food. So as we take kind of a general step back and take a look at treatment for inflammatory bowel disease in general, this really is a team approach. This is multifaceted. There are many petals to this flower, or many spokes to the wheel, depending on how you want to look at it. And we just had an incredible presentation from Dr. Kiefer just about the importance of psychosocial elements, stress reduction, and the roles that do play on the general well-being of patients with inflammatory bowel disease. We all know there are elements with medication and surgery. We know that sleep plays a role. We know that there's complementary and alternative medications that are out there. We know hormones are playing a role. We just don't have a very good definition about how to measure those and how that would impact possible treatments, but it does play a role. But today we're really going to be focusing on the diet and medical foods, but understanding some of the genetics behind that, and I'll get into that in a little bit more detail. But I think underlying, the overall approach to treatment of patients with IBD is have to be cognizant of how many elements play a role, how many variables to consider. Some patients may benefit from just a simple medication. You have left-sided ulcerative colitis, and all you need is to take mesalamine twice daily to maintain your disease. That's wonderful. But for somebody who may have more complex or aggressive disease, you may find you need a combination of many of these variables in order to adequately control your disease. And today we'll be focusing on diet and medical foods. So in general, we look at this little schematic. What does a healthy gut look like? There's this phenomenon called eubiosis, which just means a balance of the bacteria that live in your system. We know you would have, in theory, good mucosal integrity, meaning there's no breakdown of any tissue lining your GI tract. And then there's a certain element of tolerance that would come into play based upon different factors. But we know when there's some type of disruption that can occur genetically, environmentally, or otherwise, that's what predisposes people to develop inflammatory bowel disease. So there is an imbalance of the bacteria in your system, what we call dysbiosis. There may be a phenomenon, what we call leaky gut, and that's where the mucosal integrity has now been compromised, and these cells that used to kind of stick together and form a nice protective barrier or layer preventing the bacteria that line your and pass through your entire GI tract are now being able to access your blood system and your immune system, thus adding kind of fuel to the fire of what's going on. And then there's an inflammatory component for folks. So numerous risk factors come into play that do influence one's version of inflammatory bowel disease. And then there are many therapies that come into play that would ideally bring this inflamed, aggravated GI system back into health, as indicated by that modified tri yin and yang on the left-hand side. So underlying the pathogenesis or the development of IBD, again, there is some type of genetic predisposition, which I'll show you a little bit more detail about in a second. So a lot of genes come into play with this disease, 200, 250 genes and counting. influence inflammatory bowel disease in some fashion. So I often tell my patients, everybody's book is a little different from another person's, because your disease may behave as even though classified as ulcerative colitis or Crohn's disease, can be very, very different in terms of its presentation, its triggers, and how it manifests itself and what treatments you may respond to. So we know that genes play an incredible role in what's going on. We also know that there's an immune system component or an immune regulatory defect that's at play. And that, again, has some tie-in with the genes that you have, but also maybe doing to other things, NSAIDs that can cause damage to the lining of the small or large intestine. But there is some type of breakdown or variable that's affected the integrity of that immune system, which predisposes you to the inflammation and the flare of your disease. And lastly, we have these environmental triggers, for which we're going to really focus on today, between diet and the microbiome. So I'm trying to jazz up the diet talk as much as possible to put it into some real life terms, so people better understand what's truly going on from a conceptual process down to these really nasty, intricate images that I'm going to show you down the line, which is what we look at. So if you think about it this way, your immune system and your gut and inflammatory bowel disease kind of actually begins with this force field. The force field that I'm talking about is the mucosal layer and that lining that I referenced in that first slide, that thin sheet of tissue that separates the highest bacterial biodiversity in the body from accessing your immune system and your vascular system. So you have this innate force field, so to speak, which is this mucosal layer that lines the small and large intestine. It's kind of slimy in nature. It contains lots of different proteins and components of your immune system that actually helps to fight off bacteria, viruses, fungus, etc., from infiltrating your system and preventing people from getting very, very sick. So the force field is kind of your first line of defense of your immune system. And as you can imagine, this is just a picture from Thor, I believe, in Asgard, but they have this force field around it. But in the case of inflammatory bowel disease, all it takes is some type of pathogen, some type of breakdown in that force field for these bacteria then to gain access to your system, and that's when the havoc begins. And so once something is infiltrated and accessed the immune system and began triggering an inflammatory response, that's really where the damage begins. And your body begins sending out false signals over time that there is some type of pathogen or bacteria or virus that's invaded your system. And even though time has passed and your body might have actually dealt with it, the signal has gone out. The signal has gone out to far and wide, saying to your body, I need all the help I can get to help fight what's going on down here. And so your body reacts naturally and says, I'm going to send all these immune mediators down to that area, white blood cells and other components that help to kill whatever may be going on there. But that's where the inflammation comes from, is all those immune mediators flying to that area, these messengers called cytokines, these other interleukins and proteins of your immune system that rush to that area to try to help out your body because it got a message from it saying it needed help. But there's actually nothing going on there. It's back to normal. Your body is actually taking care of it, but these false signals keep going out over and over again. And so we find there are lots of different things that can precipitate your body from overreacting. It comes from viruses and bacteria. It may come from taking NSAIDs, which can break down this force field or the mucolytic layer that lines your small intestine or your colon. Or it may even come from stressors in life, like Dr. Kiefer talked about, that can make people really, really agitated and irritated, and that manifests in their GI tract. Lastly, what we're going to focus on today is how diet actually plays a role in breaking down that force field and penetrating that force field and activating the immune system. So if you wanted a really harsh diagram to look at, these are kind of ones we stare at in medical school of what's actually going on behind the scenes. You'll see way at the top, that's that force field I was talking about. There's this kind of slimy layer, this mucus layer that contains a bunch of proteins and enzymes that is your first layer of defense. But as you find some of these proteins, some of these bacteria, they begin infiltrating and they can bury their way through that mucolytic layer and then begin separating these cells out. And these cells are held together by these things called tight junctions and other little proteins in there to keep the walls, so to speak, of your system together and prevent things from crossing it. But certain diseases, certain foods, in this case, we'll talk about, begin separating and making these junctions and the cohesiveness of the system looser. And so things begin infiltrating in, and they begin activating the immune system, and all these other different types of cells begin sending out messages down one pathway and another pathway and another pathway. And all the medical treatments we have available are currently targeting different types of helper cells and interleukins and cytokines. And for some people, we find these medications work really well. For other people, we find they don't work well. But we're going to get into a little bit more of the nitty-gritty on the dietary side, but just to understand how complex the system is. That's really why I'm showing you what a schematic looks like of what's going on once these messages begin sending out from an area that's been affected. So just a little bit of background on the microbiome and genes, and that was all kind of a backdrop just to give you an understanding of where we are overall looking at IBD, the things that affect it, and we're focusing on just one element of that. But in your GI tract, you have over 100 trillion microorganisms, and that equates to, in an average sized person, almost 2 pounds of bacteria, which is pretty insane to think about. And those bacteria encode a number of genes, millions upon millions of genes. And we do know some of these genes make for a different representation or presentation of disease, certainly in Crohn's more so than ulcerative colitis, but these genes are so critical to giving your version of this disease and how it may manifest and how it responds to treatment. But underlying all of this, we know this is a very, very complex environment. As you can imagine, 100 trillion microorganisms, of which there are, millions of different types of those microorganisms. But a complex environment leads to a complex disease. And I'm just trying to underscore, the tip of the iceberg that we are beginning to understand with the microbiome and genetics. Again, here's just a little schematic showing you a variety of genes in both ulcerative colitis and Crohn's disease, and the interplay between those two, this middle area that are shared genes in both of these diseases. And so that's why we find a lot of the medications we put people on for either one of the diseases may be actually beneficial for both. And again, how things like diet, exercise, and other variables do affect both diseases fairly equally. But turning back to this intestinal wall, and I just want to focus in a little bit tighter on some of these junctions or the union of these cells as they come together, because these cells are really the second line of defense in your body. They're normally held together very tightly, but as time goes on with inflammatory bowel disease or due to some type of trigger or some type of dietary element that you may have or components of the diet, these tight junctions actually begin to and can begin to separate, which, as you can imagine, that's going to allow more and more stuff from this microorganism-rich lumen of the small or large intestine for these bacteria to access your immune system and really begin sending out the messages for inflammation throughout the body. And the reason that these tight junctions are important and how it plays in the diet is that we know there are these microparticles, what we call the Trojan phenomenon, where components of your diet, food that you may eat that has some type of processed element, some type of emulsifier, thickener, solidifier, packaging in the form of bisphosphenols, and other contaminants actually come in different types of foods that are not primarily organic based. And these microorganisms or these microparticles that access the immune system actually begin this inflammatory cascade, and your body begins reacting and sending out the message that it needs help. So underlying the diet, yes, we'll get to some of the foods and food groups, etc., but understand just the premise behind how food is in the Western world especially. We know that processed food contains a lot of these microparticles, which we're seeing increasingly that these are important to understand, recognize, and try to eliminate when possible, because they are the initial spark for a lot of the inflammatory response of your body. And we do know, as we'll get into further down the line, there are different types of foods that certainly impact the GI tract, what we call pro-inflammatory foods, filled with fat and sugar and salt, definitely have lower vitamins. They may have certain types of fiber that agitate the GI tract. But we do know most of our energy intake especially in westernized worlds and in westernized nations, and specifically in North America, that this is a major component of our diet. And there's a whole science behind diet, why things get injected or added with fat and sugar and salt. And there's a whole psychological element that actually plays into food and diet to trigger different receptors in the brain, specifically the dopamine pathway that get people more or less addicted to certain types of foods. So it's a conscious act that we all have to be aware of when you're shopping and when you're preparing food or eating out, just what kind of elements may be in there that could possibly trigger your version of your disease of inflammatory bowel disease. And again, this may not impact every single patient with IBD, but it's just another element to think about when it comes to how can I best treat my disease, and just know diet plays a tremendous role. And again, these concepts not only lend themselves to inflammatory bowel disease, but other autoimmune diseases, diabetes, thyroid disorder, rheumatoid arthritis, the list goes on, and applicable obviously in the cancer realm. In oncology, there are many things they talk about with diet in terms of anti-inflammatory agents. We know that sugar is the devil in a number of ways. So we're going to get into a little bit more detail as we go down the line, but understanding, processed foods and the westernized diet, and not only the food itself, but the elements contained within these foods can be really problematic for folks. They've done a lot of research. Specifically, there's a great group out of University of Pennsylvania that is doing a few studies associated with the Crohn's and Colitis Foundation, looking at diet. And I'm going to talk about those in a little bit. But looking back, over the past decade or two, as diet has gotten much more attention for inflammatory bowel disease and specific types of foods, this is a chart. I'm not expecting you to understand the nitty-gritty of what this is showing, but what we do have is various food groups, cereal products, vegetables, fruit, milk, dairy, fish, eggs, meat, red processed meat, alcohol. And the ones that are circled in red, when they looked at diet for patients with, I think it was Crohn's disease or inflammatory bowel disease in this case, they looked to see which of these food groups would cause a relapse in disease. And the ones at the bottom that are highlighted in red, eggs, meat, red processed meat, alcohol, those all showed what we call statistical significance, meaning it was reproducible. It's a reliable statistical result that people who took higher diets containing eggs, meat, processed meat, alcohol were more prone to have relapse of their inflammatory bowel disease when they had been in remission than those who had a lower intake of those foods. That just underlies some of the broad strokes that we've seen throughout the years, and we'll see as components of the diets we'll talk about shortly. But as you can see, fruit and vegetables, kind of conceptually, people would probably agree with that. And then lean meats tend to be less egregious in higher amounts than red meats and higher fat containing foods. So question we see a lot of nowadays is, does Western diet have ramifications? We know that, North America, Western Europe have high rates or the highest rates of inflammatory bowel disease, but we've seen recently that emerging nations, other nations in Eastern Asia, et cetera, have actually seen spikes in new cases, incidents of inflammatory bowel disease. And part of the hypothesis is that there's influence from the Western diet in these nations, and that's actually leading some of these countries to begin having it. There's an interesting study put out recently by Kaplan, and this is just focusing on 3 different phases of inflammatory bowel disease. The ones in orange represent where we know we have disease: Australia, Western Europe, North America. Where we see the countries in yellow, that's what we call an acceleration in incidence. These are second and in some cases third world countries that are now seeing spikes in inflammatory bowel disease that they never had before. That coincides, I think, with Westernization and advancement of a more processed food diet as our food chains have dramatically changed worldwide. And then we see in some of these nations in Africa an emergence, meaning they had never had inflammatory bowel disease before. And then now all of a sudden we're beginning to see signs of that. So we do know that Western diet and a processed food diet is certainly playing a role nationwide and worldwide. Another interesting study, we've seen this a bunch, is what happens and I think it further supports what we see in these emerging nations, but people who have emigrated to Western Europe and to North America. This is a study that looked at the incidence of Crohn's disease within one generation compared to the next generation. And as you can see, in different countries and part of the first generation, there may not have been an incidence of that Crohn's disease, less likely. But as you find in the second generation of people who have immigrated to westernized nations, North America, you find that the incidence of Crohn's disease rises dramatically. And across nearly all of these different countries of origins or regions of origin, for people who had emigrated, they had gone up and became statistically viable for people who had Crohn's disease, with the exception of, it looks like, Latin America. So very interesting to know, but we certainly know environmental factors are a large contributor to IBD, and underlying that is a majority of that is going to be due to diet and the components of diet. So broad strokes, and before we get into the details of individual diets for inflammatory bowel disease, and kind of piggybacking on that chart that I showed you, we do know that fruits and vegetables are very healthy for you. We know that omega-3 oils from fish and food, lean meats, are healthy for you. We know that fats and sweeteners and additives and preservatives and red meat and processed meat are less good for you. And so trying to minimize that. And when you see the general theme of the diets we're going to discuss down the line, you'll notice that the concepts are very similar to one another. So broad strokes, this is what we're looking at, and all diets are kind of going to piggyback on this general theme. So just to take a step back, and this is also kind of inspired by a speaker we've had a few times in the past, Dr. Hand. So anybody who's had previous interaction with Dr. Hand, a very, very remarkable speaker out of New Hampshire, a pediatric nephrologist. But one of the things that has stuck with me, and I've actually asked and actually posed this to patients as the way in which I introduced the concept of diet, is he brought this up at one of the talks, and I think he's brought up at a few of the talks, but he'll ask a patient, donut or the apple? I substitute for berries out of consideration for the low FODMAP diet, but conceptually, I think you understand the process. So when patients ask me, what should I eat, doc? This is often the question I'll rhetorically ask them again. They'll say, well, if I give you the choice between a donut and an apple, or donut and berries, or donut and banana, which should you choose? And it seems self-explanatory, right? Of course, the answer to the test question should be that you're going to eat berries or banana or banana, and to not eat the donut, because the donut contains a lot of things. And as you can see, Homer, looking at this glow-in-the-dark donut, there are probably a lot of things that are not going to help the inflammation, while things like berries and fruits and vegetables and other anti-inflammatory foods are the best thing to provide to his body as nourishment, as opposed to processed food. Even though it may taste very good, there are lots of ingredients in there that can only do damage to him in the long run. So apple or the donut, apple or the donut. And I think we all know what the choice would be in this case. Taking a look at vitamins and minerals, certainly there are a lot of different vitamins and minerals that play a role with inflammatory bowel disease. So these are things that I often will check on patients when they come to see me in the office, at least once or twice per year. And depending on if they've had different types of surgeries and where the layout of their disease may be, that may influence certain ones being more important than others. But vitamin B12, very important for nerve, blood cells, keeping them healthy, and other neurologic processes. It's a cofactor for a lot of things that help with your body fighting inflammation. Same thing with vitamin D in terms of lowering inflammation and regulating the immune system. There's been a lot of data with the vitamin D, and we have seen some studies that suggest that higher levels of vitamin D are better, but certainly we've seen that patients who have low vitamin D are maybe more at risk. It's not gotten to the point where these studies have shown that vitamin D is a definitive therapy and recommendation for everybody, but certainly people with low vitamin D should be supplemented to optimize their system to fight inflammation. We know zinc is important for fighting bacteria, for wound healing, It also helps with epithelial barrier. We find a lot of folks with distal small bowel disease may have zinc deficiency, and this one is becoming more and more prominent in terms of things we check, and certainly reflected in guidelines that we get in monitoring patients. Iron is always very important. It carries oxygen. Oxygen is very important for all functionality in your body. So people who do have low hemoglobin have low iron by definition. Low iron means low oxygen, and oxygen is important for inflammatory purposes. Calcium helps out with bones and teeth, and also important. It gets depleted when people are on steroids. Folic acid helps your body to produce and maintain new cells, and also helps out with processing of carbohydrates. And finally, to complete out the fat-soluble vitamins, vitamin D being a fat-soluble vitamin, but also A, E, and K. This is important for cell production and preventing damage, and as well as fighting infections. So these are all things to be mindful of and to periodically be testing and optimizing in order to make sure that your body has any and all ingredients it needs to do what it needs to do to either to fight inflammation or keep it at bay. So we're going to kind of go into what the quote unquote dietary medicines are. And by that, I mean the different foods, because diet is a medicine. Some people can control disease with diet alone. Others need diet plus different medications, plus stress reduction, plus good sleep, etc. So there's one of the many types of therapies that we have for inflammatory bowel disease. And the main ones we tend to see about, and you all have probably seen in passing throughout time, but we do know about enteral nutrition. We'll talk about the Scd diet, the Umass, Anti-Inflammatory Diet, low Fodmap, Mediterranean, and then probably the newest player, which is what we call the Israeli diet in some circles, but it's the CDED plus the EN, and this came out of a study out of Israel in the pediatric population. And I have a brief mention about microbials, which include pre and probiotics. Enteral nutrition, this tends to be used in the pediatric population, but it is a dietary treatment for inflammatory bowel disease, often delivered by NG tube because most people don't want to tolerate this orally. Certainly it can be taken in that way, but because of the pediatric population, the palatability, it often is delivered by a nasogastric tube. But this contains all the major components in terms of vitamins, proteins, minerals that somebody would need. Generally, people go on this for 8 to 12 weeks, sometimes less, sometimes more, in order to just get the system under better control as medications begin working. But it does not suppress the immune system, which is the difference in this therapy versus other ones. It also helps to heal the lining of the bowel by decreasing inflammation. And there are some studies that have suggested more in the pediatric population than in the adult population that it's as effective as steroids at inducing remission, which is pretty amazing to think about. But again, often used mostly in pediatric realm, but not in adults. Scd Diet, a very famous book a lot of people have probably read about. It's called Breaking the Vicious Cycle, one of many, 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 many books about the specific carbohydrate diet. But the concept of the specific carbohydrate diet is to remove many of the complex carbohydrates that are not well absorbed because they can lead to fermentation, and fermentation, as you know, is the production of gas when sugar and bacteria interplay. Fermentation, kind of like the head of a beer, it makes it really gassy, bubbly, bloated, distended. People feel generally pretty awful when they get really distended and bloated. We do know for a lot of other diseases and syndromes, fermentation and this concept also applies. Irritable bowel, which I argue most people have a component of. It comes in different shades, that being either diarrhea prone or constipation prone or back and forth. But inflammatory bowel disease and irritable bowel often look very similar. And when somebody is having a flare, we're not always entirely sure, is this just an irritable bowel reaction, or is this actually an inflammatory bowel disease flare that's going on? Because so many of the symptoms can feel very similar: pain, discomfort, diarrhea, bloating, etc. But we do know, not only with inflammatory bowel disease, but irritable bowel and other autoimmune conditions, that there is certainly benefit from trying to minimize carbohydrates, because when carbohydrates meet bacteria, you get gas. and gas causes distension of the bowel, specifically the small bowel. And when people have stretch of the small bowel, that's what creates pain. You don't have pain receptors like you do on your skin when people touch you inside of your GI tract. You only have pain receptors to stretch. So really a lot of the discomfort that people have from Crohn's, ulcerative colitis, and beyond actually come from the stretch due to either the gas from the bacteria that's been broken down, or fluid or effluent that has not gone where it needs to go due to obstruction. And that's what causes dilation of small bowel and or large bowel, which creates pain. So gas can certainly have a dramatic effect on the symptoms and the well-being of and the quality of life that somebody can have. And that's why we've seen, and we see it throughout all these diets I'm talking about, that bacteria do love sugar. And so trying to minimize the types of sugar are so important to treating the underlying condition and making people feel well. So back to the Scd diet. So again, complex carbs beget fermentation, which is gas and bloating. Monosaccharides are allowed. I'm trying to avoid these polysaccharides, and by monosaccharides I mean glucose, galactose, and fructose, which are the three main monosaccharides. So things like honey and fresh fruits and lots of vegetables are certainly okay. Grains, canned fruits, lactose containing dairy, not okay. Processed meats, smoked meats, canned meats, not okay. There have been clinical trials in the past looking at the Scd diet, and have been rather mixed in terms of the efficacy. One of the more interesting studies that's coming out right now looks at comparing the Scd diet to the Mediterranean diet, which I'll get to in a second, in Crohn's disease. And there's actually a study that's funded through the Crohn's and Colitis Foundation and another group called PCORI, and results are, I guess, going to be due out fairly soon with that, because I think they've closed enrollment. So I imagine in the next 6 to 12 months we'll really get some conclusive evidence about this. But just to backtrack with diet and research, diet is a very, very, very hard thing to do clinical trials on. As you can imagine, if you were to enroll in a dietary study, and if any of you have already, I mean, kudos to you, it's very challenging. But to try to minimize the amount of noise that may come from that trial, meaning, what foods are you eating? You have to eat a set amount of food per day without any variation. You have to try to isolate as many variables as possible to try to control for as many variables as possible to see how much of the improvement or not comes from the diet is very challenging, because there are lots of variables. There are lots of things that happen on a day-to-day, week-to-week basis. So these diets are very, very hard to study very well. And I think this has been an incredible effort done by CCF and PCORI to look at the Scd and Mediterranean diets, which are probably the two most readily followed diets in the inflammatory bowel disease universe. The Umass anti-inflammatory diet, similar concepts to the Scd diet we just talked about, but with additional focus on the microbiome. And there are 3 different phases to this anti-inflammatory diet, and it definitely has more rigor to it than something like the Scd, because this definitely has checkpoints and things you need to do along the way. But there are 3 phases to this. There's one with probiotics, which are fermented foods that do have live bacteria. A good example of that would be yogurt or kefir. The second component or second phase is prebiotics, and these are foods that help to feed good bacteria in your body, and that being different types of soluble fiber that are not wheat-based. Third component is avoidance, so avoiding pro-inflammatory carbohydrates, and by that I mean lactose, sucrose, corn, and then underlying that is just good nutrition. So they do have a nice diet that's been laid out, variations of this diet on the Umass Med website. But again, it's applying similar concepts to what we saw in the Scd. We know where complex carbohydrates are not good because they ferment and make lots of gas. They contain other things, additives, emulsifiers, etc., that you see in dairy-based products that can begin triggering inflammatory reactions in people. So the same theme we're starting to see time and time again with each one of these diets, but I think with a slight bend on it compared to the Scd. So often get this question from patients, but how can I eat fiber without eating wheat? Because we know wheat, and specifically probably 99% of wheat that's out there today in the supermarket, is genetically modified, and it's genetically modified for a number of reasons to help more robust plants growing quickly with less disease. But as a result of that, wheat is transformed over time, and our bodies are less and less capable of digesting it as well as it might have been 50 years ago. So that's why I see a big push for the ancient grains, which and other seeds and things like flax that have good sources of fiber, but may not necessarily be wheat-based. But we do see an increasing presence in supermarkets of gluten-free, of going back to ancient grains when possible. But there are possibilities of obtaining fiber that are not wheat-based. And here's a good example of a supplement here. This is from Garden of Life, but it's organic fiber that is gluten-free, psyllium-free, dairy-free, soy-free. So for a lot of our folks who do have a lot of sensitivities to food, this would be a very good way to help supplement that because it is a great prebiotic for folks. Low FODMAP, people have probably heard this if they've ever come to see me in the office, and hopefully any of my colleagues. But again, a diet that applies not only to inflammatory bowel disease, but also to a number of things like irritable bowel, bacterial overgrowth, etc. FODMAP is just an acronym that stands for fermentable oligodisaccharides, monosaccharides, and polyols. And these are just essentially short chain sugars that your small intestine does not absorb very well. And when these sugars hit the bacteria that line the small intestine, like we talked about before, those bacteria begin fermenting these sugars. That makes a lot of gas. Gas causes distension and bloating, and that may be a propellant for some people, i.e. give them diarrhea, so irritable bowel with a diarrhea component, or they may have constipation because the gas is constipatory and does not allow effluent to flow through as efficiently. But the net result is a lot of these simple sugar, short chain, carbohydrate-based foods make people gassy, bloated, discomfort, maybe even nausea, vomiting, may make acid reflux worse. So this diet is searching to avoid those high FODMAP foods and go for low FODMAP foods. And you do that for some period of time, and then every few days, usually every 3 days or so, you begin introducing a high FODMAP food once again and see if you tolerate it. If you don't tolerate it, then you know that's a trigger for you and you avoid that in the future. Again, this is not a long-term diet recommendation to be on for life, because as you may realize after looking at the diet more intricately, there are some key elements that are missing from this that are important to overall health in terms of vitamins, minerals, etc. So a great one for short term for research purposes and identifying triggers, but I would not recommend it as a long-term diet for people to be on. There have been some studies looking at this, and we're going to see probably more stuff come out in the future, but we have seen low FODMAP diets in IBD patients being helpful to maintain remission. So as you can see on the schematic on the right, there's some foods they recommend avoiding. In the dairy realm, they recommend avoiding lactose-containing dairy, which is the same theme we've seen through all diets. They also recommend, let's say in the fruit realm, peaches, plums, pears, papaya, mango, avocado, watermelon, apples all make lots of gas, but berries and oranges do not make as much gas. And then in the vegetable realm, we know that the cruciferous vegetables, or the nightshades like Brussels sprouts, cauliflower, broccoli, cabbage make a lot of gas, but other vegetables such as carrots and different types of leafy greens like lettuce, olives, corn may not actually do so. We know certain types of beans, as you could imagine, black beans and lentils, things like that make a lot of gas, but there are other nuts that may not necessarily do that. And finally, it's the low FODMAP diet is careful at pointing out all the different additives that can come in different things like chewing gum, breath mints, cough drops that can certainly agitate the system. These sugar alcohols like mannitol, sorbitol, isomalt, xylitol can all be very, very problematic for people. So that's, again, further emphasizing the importance of eating clean foods, fresh foods, and avoiding processed foods, because it's these other elements that come to help give food a shelf life in a box, a can, or a bag. Those are the ones that are actually beginning the domino effect of the inflammatory cascade for many folk with IBD. The Mediterranean diet, another great diet. It is a plant-based diet, emphasis on fruits and vegetables, but also with lean meats like fish and chicken and lamb. But again, we found that this type of diet, probably across the board in all of medicine, is they claim the #1 diet, and not mockingly put the U.S. News World ranking thing at the bottom, but somewhat mockingly just because it's funny. But we've seen time and time again, year after year, the Mediterranean diet for a number of reasons, not only in inflammatory bowel disease, but in cardiovascular health and other autoimmune diseases. The Mediterranean diet is really a phenomenal diet because it is anti-inflammatory by nature, and it follows many of the same concepts that we've highlighted earlier in the talk about avoiding processed, avoiding high fatty meals, and trying to stick with low fat, high quality, fresh, organic, with a good mixture between fruits, vegetables, and whole grains and nuts, to the best of your abilities. And this is just a diet that tends to follow that very, very well. And again, this is a diet that Crohn's and Colitis Foundation and PCORI are currently comparing, because these are probably two of the best ones out there that lend themselves and the concepts very well to inflammatory bowel disease. So we await the results of that study from Dr. Lewis out of Pennsylvania. Probably the newest diet we've heard a lot about recently, the Israeli diet, which is a Crohn's disease exclusion diet combined with partial enteral nutrition. So the first thing I talked about with enteral nutrition, where you have some type of liquid that you put in orally or via an NG tube. So a partial component of that combined with an exclusion diet, which is just a version of a whole food diet where you get rid of animal fat, wheat, dairy, red meat, emulsifiers, maltodextrin, carrageenan, but add in fruits and vegetables. So a very streamlined version of a diet, which looks a lot like a specific carbohydrate diet. And then you combine that with enteral nutrition. And they found it was tolerated better than just the enteral nutrition, which would come in by NG tube or drinking. So it's better tolerated than that, because enteral nutrition is very hard, very potent, and not very palatable. So better tolerated than that because you're only doing a partial amount of enteral nutrition. They also found that it was superior at sustaining remission and reduction after 12 weeks. And they looked at a few key markers, including a CRP and a fecal calprotectin, and those were their objective measurements. But I definitely think we'll see more of this. And again, this was studied in the pediatric population. It hasn't necessarily been applied to the adult universe yet, but concepts that are, again, reiterating the same thing. Western diet is tough. There's a lot of stuff that comes in a Western diet that precipitates flares. An exclusion diet, which is a version of the Scd diet, plus putting the proper, clean proteins, vitamins, minerals in the body, we found benefit to. So again, we know we are what we eat, and if you put good ingredients in that are clean, you're going to do better. Just a quick note about prebiotics and probiotics. This is considered a medical food, and we do know there, if you go to the supermarket, you're going to see a lot of things. You're going to see a lot of things out there. This is one of the #1 questions I get asked. What kind of probiotics can I use? Prebiotics, etc. And there's a lot that's out there, and they certainly do have some function. There's a lot of research on clinical trials going into this very concept, because we know, as we talked about at the beginning, this force field and the components of that force field are so important to regulating your immune system and either protecting your body from pathogens or reducing injury due to other things that are going on. So we know there is some type of role. I think just the science lags behind that right now. We're getting better and stronger, but when you look across the board and you see these studies that are coming out, looking at the probiotic, and the reason I put this on the screen is to make your eyes cross a little bit. That's the shock factor. But you go to the supermarket, you go to Whole Foods, and you look at probiotics, and how many different ones are there? There's hundreds and thousands probably at this point in time. So which one do you choose? And we really don't have a great data repository from clinical trials or otherwise to say with good quality evidence and with good grading that this may be better than this for this disease. I think it's still evolving. And the reason that is if you look at this is called an LDA on the right-hand side. It's just looking at the different species of bacteria that exist in your body, specifically in your GI tract. And this is just the tip of the iceberg. And this is where I think inflammatory bowel disease and genetics and the microbiome are all headed. But as you can see, different diseases, either Crohn's or ulcerative colitis, may be more prone to have certain species of bacteria in their body, and a lack of certain type of bacteria may be able to be treated with resuscitation or augmentation of that certain bacteria to help restore a healthier environment. This is definitely in its infancy right now, but it's just to underlie just how complex and how many different variables come into play. As you can see there, just on this screenshot, 20, 30 different types of bacteria for this one particular LDA. And if you can imagine, when you go to the store to go buy a probiotic or go to Amazon, which one do I get? Because each one contains different species. It may have 3 different species in there: Lactobacillus, Bifidobacter, and Saccharomyces. While another one may be only Lactobacillus, while another one may be only Saccharomyces, or other different ones that you see on this list. So it is very complex. And with that complexity, again, we're not quite sure how well each one of these subspecies may benefit each person, because you're slightly different than the next person, But as we get better over time, understanding the fecal fingerprint, as they say, or your particular version of the bacteria or the microbiome that you have, we may find that certain type of bacteria can be augmented to achieve a better health. But we're still years and years away from that, but it is on the horizon. We've seen some data out there. There's a group called Cochrane that looks at all the available evidence that's been published in the scientific medical community and looks at all this data, scrutinizes the data to see, what is the level of evidence, how good is the level of evidence, and what are the conclusions based upon the studies to let us know whether or not probiotics are helpful or not. And there are 4 major categories on the left. For both remission of Crohn's disease, inducing remission in Crohn's and ulcerative colitis, and then maintaining remission in Crohn's and ulcerative colitis. And their conclusion out of all of these is that probiotics probably do not have a role in Crohn's disease at either induction or remission that has been studied thus far. I'm not saying that may not change in the future. And then for ulcerative colitis, there's low-grade evidence suggesting that maybe there is some benefit to probiotics, and out of all of those VSL number 3, or the constituents that come in VSL number 3, and there are 17 of them, there may be of some benefit to people. With that being said, to the last picture, when you go to the supermarket and you see all the different ones, so which one do you choose? And I'm not ever going to say they're completely useless. I'm just going to say we just don't have a good body of evidence behind them. Some people may feel better taking them, and I think that's wonderful and great. But in terms of ones that I recommend to patients, I have a pretty short list, and there is a body of evidence from a probiotic task force in the United States, for which I use about 5 or 6 different probiotics that I think have some decent evidence for short periods of time. But again, the GI community is torn about the role and the efficacy of probiotics, and that's mimicked in the analysis of the studies that all exist. So I think there may be some benefit. I just don't think we understand it well enough, and it's to patients to decide if it truly helps them. Then okay, there's probably very little harm that would come from it, but I would not use it as a panacea for achieving and maintaining remission of your disease altogether. With that being said, thank you for your attention. Feel free to send some questions via chat. And yeah. I see a couple messages. Nothing direct yet. Thank you for the well wishes and the compliments. Yeah, and you will find there is some conflicting data on diets. The question is, one side said to avoid eggs, another slide says eggs are okay, and I guess it just depends on each one of these diets. Certain ones may actually include eggs, while other ones may not include eggs. And again, there's, I think, understanding broad strokes and trying to pinpoint what would make most sense for people. You know, eggs you have to be probably careful with, because eggs contain, it depends on how the eggs are harvested. You know, are they organic? Were there any involvement of chemicals or anything else that may be included? So that's the thing to think about. If you're raising your own eggs coming from chickens on your own grassy farm, then I think you may be in good hands. But I think you have to be careful with eggs, like you do every food. And a comment from Melissa: I've definitely found diet plays a big part, and each person has different things that work well or not for them. I would absolutely I agree with that 100%. I have plenty of patients, especially the low FODMAP diet, will say, you know, I recommend, you know, they say asparagus really bothers me, and every time I have asparagus, it makes me feel lousy. But the next patient who's on a low FODMAP diet has no problem with asparagus. So everybody's genes and everybody's tolerance is very different, and that's why you see, you know, such a vast array of options for diet. And yeah, just another comment from Melissa about diet being very helpful for her large intestine. And yeah, absolutely. I think not only for IBD, but just for us in general as a society, to be quite honest. We're just seeing more and more people, especially, you know, non-IBD, that come in and they have issues with their GI tract. And 70% of it boils down to diet. And as diet has changed over time and people eat out more often or get prepared meals, I think it's doing some destruction. I think when people had more organic food and cooked more at home years ago, I think we're in a lot better state, I'm imagining. But Robin had a question about genes. I do talk about genes a lot, and we don't have good testing yet. I think that along with the microbiome, and that's why I wanted to hint on it at the beginning, is, you know, genes and microbiome play a huge role. We don't yet fully understand it. We don't know how to incorporate that into how we treat people, but we do know things like diet and our environment certainly can affect and change those genes. And I think that's the emphasis I want to place, is that these genes are not a static entity. The genes can be turned on and off based upon a number of factors, but diet playing a huge role with people, and then other things like antibiotics and the incorporation of antibiotics into genetic code may also play a role. So there are, it's a dynamic entity, and I think that's why you see a lot of these diseases may evolve over time with certain people. You know, and quite frankly, you know, why did you present, you or another person, why did you present with disease at age 42 and not age 14? And, you know, people are born probably predisposed to UC or Crohn's disease, but if something happens over time that influences their body to then activate and the inflammation begins. And the fact we see it beginning in school-aged years for people, and in high school, we definitely know that there's a role of diet and the components of diet that finally activate and cause things to begin switching around. Another comment about a great book that helped her was What to Eat with IBD by Tracy D'alessandro. Yeah, with some great recipe ideas. And again, I think there's lots of good information out there. And if you had to take a step back from all these different diets we talked about, it's again seeing that fresh is better, organic is better, avoiding processed foods is better, plant-based is better, and all the evidence points towards that. And with the choice of a donut or the berries, I mean, that's a decision that people have to make constantly. Feed your body the anti-inflammatory foods first. I think that's the key concept that the Dr. Hand also had said, is so treat your body well, treat your body with those anti-inflammatory foods first. You may have a bite of the donut, you know, periodically. Some people can tolerate it better than others, but definitely feed the system the anti-inflammatory things first. But all right, so unless there are any other questions, I will make sure from Arushi to make sure you fill out your post-webinar survey if you haven't already. And any other questions at any point, always feel free to reach out to me via CTGI or Rushi, whatever it may be. Happy to answer any and all questions. And thank you again for your attention on this blistering day. And I'm glad we could do it by Zoom because it looks like we wouldn't have had a conference probably. So yay technology. All right, thanks everyone.